Hello, and welcome to another Get Set Up session regarding Medicare. I'm your guide, Keith Gilbert. In today's session, we're going to talk about how to avoid common mistakes when it comes to Medicare cost. So just keep in mind, there's a lot of different costs that you may be aware of or may not be aware of, but there's some common ones that people make a mistake on or just assume that we're here to talk about today. So thank you for joining us for this session with Get Set Up Medicare and how to avoid some of the pitfalls. So some of the bigger things that can be confusing is Medicare can cost you big. It can be very expensive. You may be able to get zero opportunities for zero costs. You may have to pay $500-$600 out of pocket for certain things. Depending on your Medicare Part A, you may have to pay, if you've paid into the system for the last 40 quarters or over 10 years of working, you shouldn't have to pay for Part A. But some people do. Medicare Part B, there's costs there as well. So today we're going to talk about some of the most common mistakes people make regarding Medicare coming up in this new season for 2025. So let's start off with number one. Besides it being confusing, we know that, right? But how to avoid some of these mistakes so you don't have to pay out of pocket for certain things that you don't even have to pay for or you shouldn't be paying for. So some of the common mistakes are, these Medicare mistakes are the following. You could be paying more than you should be. You should be paying less than you are paying, but you didn't get the help that you needed to understand what's the right fit for your needs and your budget. I would say number one, definitely do your homework, compare your plans, talk to your insurance company that you're currently with, go to Medicare.gov, look at your Medicare and You guide when you get that in the mail, review your ANOC letters. All these are different starting points. Ask for help. Help is free. You can reach out to a licensed agent or a broker or a benefit advisor or counselor, and they can help you. There's always help available through Social Security or picking up the phone and calling Medicare. Try to find the right fit for you. So here are some of the key points that we're going to talk about today. Initial enrollment period. A lot of folks don't understand that when you turn 65, you have what they call an initial enrollment period, your first time. Or if you were on Social Security disability prior to age 65, you still have another enrollment period when you turn 65. Okay? So in that initial enrollment period, it's 3 months before, the month of when you are guaranteed to come into Medicare, and 3 months after. So it's a total of 7 months is your initial enrollment period. You don't want to miss that because there's some guarantees in there when it comes to some things like the Medigap or the Medicare supplement options that'll help you pick up the 20% that Medicare doesn't cover. So you want to look into those, and you have some guaranteed rights that are available for you as well. So make sure you understand the correct timing, number one, of your initial enrollment period moving forward, okay? Also, when it comes to prescription drugs, make sure you understand your prescription drug plan, what the prescription drug program offers, and some of the key things is people don't think, well, I don't take any medications, I don't need a prescription drug plan, right? I would beg to differ. What I would say is always double check, get help, compare, make sure, even if you don't take prescription drug plans, there may be a penalty that you can avoid by picking up a prescription drug plan or getting a Medicare Advantage Part C plan that includes the prescription drugs, Medicare, some people call it an MAPD, Medicare Advantage Prescription Drug, or a standalone prescription drug plan, unless you're a veteran and you get your prescriptions from the VA, okay? So just keep in mind, you can avoid that penalty. So it's a 1% penalty for every month that you are eligible, starting at 65, to be on a prescription drug plan, and you don't have it because I don't take any medicines. you might end up taking that penalty very harshly later on, a year or two, 5 years, heaven forbid, down the line, and it just accumulates. And next thing you know, you got this large late penalty. So avoid that if you can. Other things you want to do is review your ANOC letter, because in that letter, any annual notices of changes, a lot of people throw them out, but you want to review that letter because that can help you avoid some cost as well. If there's an increase in your plan, if your deductible goes up, or if there is no deductible now, that's really nice. A lot of these plans are now capped out at $2,000 when it comes to prescription drugs. So you definitely want to make sure, or even if your plan is going to be around in 2025, also understand by reaching out to your local representatives, brokers, agents, your insurance company that you're currently with, Medicare.gov, or pick up the phone. You can reach out to Social Security and definitely find out if that's the right fit for you, so you don't have to worry about paying a lot out of pocket when it comes to prescription drugs, or out of pocket costs for Part A and Part B that you were not ready for and something was to happen. So keep that in mind. Another key point is to take advantage of the 20%. If you're on original Medicare, you can pick up a new plan during the annual enrollment period. This is a perfect time for you to look at, how can I supplement my income? I'm on a fixed income. Maybe I should look at a Medicare Advantage plan now. I'm worried that maybe something might happen down the line and my health is not as good as it used to be. I don't have my employer coverage anymore, and that 20% can add up very quickly. And so looking at a Medicare Advantage plan, Part C, or a Medigap or Medicare supplement plan, typically the Part N, Part C, Part G. If you're old enough, you might have a Part F, and those are still out there. But just keep in mind that you want to look at how I can pick up the difference. That 20% Medicare doesn't cover. Most folks think, I'm good. I got Medicare Part A and B. I don't need to pick up anything else. And then something happens and they don't have a backup plan. And it's 100% out of your pocket of that 20%. And it can add up very quickly. So I highly recommend you take advantage of those things. So in conclusion, we thank you for listening today to another session of Get Set Up regarding Medicare. And today's session was regarding how to avoid some of the common mistakes when it comes to cost. So understand your Part A, your Part B, any cost when it comes to your Part D. Know that there's going to be caps now for the Part D, no more than $2,000. If you're taking insulin, no more than $35. But understand what your costs are. Just don't assume. And if you don't have any other options besides original Medicare Part A and B, you may want to look at picking up right now during the annual enrollment period a Medicare Advantage plan or a Medicare supplement, which is also known as a Medigap plan. So thank you today for listening to another session here at Get Set Up. My name is Keith, your guide, and look forward to another Medicare session coming in the near future. Take care.